Welcome back to MCQs Master 101. In today's session, we're diving into high-yield gynecological cancers MCQs, covering ovarian, cervical, and endometrial cancers. If you're preparing for nursing exams, medical assessments, or clinical practice, this video will sharpen your understanding and boost your confidence. Let's get started. 1. The most common symptom of endometrial cancer is A. Abdominal bloating, B. Postmenopausal bleeding, C. Pelvic pain, D. Weight gain. Answer B. Postmenopausal bleeding. 2. A major risk factor for cervical cancer is A. Nulliparity, B. HPV infection, C. Menopause, D. Oral contraceptives. Answer B. HPV infection. 3. A classic sign of ovarian cancer is A. Early vaginal bleeding, B. Silent growth with late symptoms, C. Severe dysuria, D. Pain during intercourse. Answer B. Silent growth with late symptoms. 4. Which diagnostic test is essential for cervical cancer screening? A. CA-125, B. Pap smear, C. CT scan, D. Pelvic MRI. Answer B. Pap smear. 5. Endometrial biopsy is primarily used to evaluate A. Ovarian cysts, B. Postmenopausal bleeding, C. Cervical lesions, D. Tubal blockage. Answer B. Postmenopausal bleeding. 6. A nurse suspects ovarian cancer when the client reports A. Sudden weight gain, B. Early satiety and bloating, C. Severe night sweats, D. Painful urination. Answer B. Early satiety and bloating. 7. HPV vaccination primarily protects against A. Ovarian cancer, B. Cervical cancer, C. Endometrial cancer, D. Vaginal atrophy. Answer B. Cervical cancer. 8. A primary treatment for early-stage endometrial cancer is A. Radiation alone, B. Hysterectomy, C. Chemotherapy, D. Hormone therapy only. Answer B. Hysterectomy. 9. A woman with a BRCA1 mutation is at high risk for A. Cervical dysplasia, B. Ovarian cancer, C. Endometrial hyperplasia, D. Vaginal carcinoma. Answer B. Ovarian cancer. 10. A major early symptom of cervical cancer is A. Heavy pelvic pain, B. Abnormal vaginal bleeding, C. Severe constipation, D. Hot flashes. Answer B. Abnormal vaginal bleeding. 11. What tumor marker is commonly elevated in ovarian cancer? A. AFP, B. CA-125, C. CEA, D. PSA. Answer B. CA-125. 12. The strongest protective factor for endometrial cancer is A. Early menopause, B. Long-term oral contraceptives, C. Multiparity, D. Regular exercise. Answer: B. Long-term oral contraceptives. 13. Cervical cancer is most commonly caused by which HPV types? A. 1 and 2, B. 6 and 11, C. 16 and 18, D. 31 and 33. Answer: C. HPV types 16 and 18. 14. Which factor increases the risk of endometrial cancer? A. Low estrogen, B. Obesity, C. Smoking, D. Multiparity. Answer: B. Obesity increases unopposed estrogen. 15. Which finding in cervical cancer requires urgent evaluation? A. Watery discharge, B. Postcoital bleeding, C. Severe cramps, D. Vaginal dryness. Answer: B. Postcoital bleeding.
16. A woman reports bloating, pelvic pressure, and early satiation. The nurse suspects A. PCOS, B. Ovarian cancer, C. Endometriosis, D. UTI. Answer: B. Ovarian cancer. 17. A pap smear result of ASCUS means A. Cancer confirmed, B. Atypical squamous cells of undetermined significance, C. High-grade cancer, D. HPV infection ruled out. Answer: B. ASCUS. 18. Tamoxifen increases the risk of A. Cervical cancer, B. Breast cancer, C. Endometrial cancer, D. Ovarian cysts. Answer: C. Endometrial cancer. 19. A primary symptom of advanced ovarian cancer is A. Constipation, B. Ascites, C. Amenorrhea, D. Breast discharge. Answer: B. Ascites. 20. Postmenopausal bleeding should always be evaluated for A. Cervical polyps, B. Endometrial cancer, C. UTI, D. Hormonal imbalance. Answer: B. Endometrial cancer. 21. A client with HPV wants to prevent cervical cancer. The nurse advises A. Avoid all sexual activity, B. Complete HPV vaccination, C. Do CT scans yearly, D. Use only herbal therapy. Answer: B. HPV vaccination helps prevent high-risk types. 22. The earliest stage of cervical cancer is detected by A. CT scan, B. Pelvic ultrasound, C. Pap smear, D. Pelvic exam alone. Answer: C. Pap smear. 23. Unopposed estrogen exposure is a major cause of A. Ovarian cysts, B. Endometrial hyperplasia and cancer, C. Cervical dysplasia, D. Vulvar irritation. Answer: B. Endometrial hyperplasia. 24. Which symptom is common in cervical cancer? A. Heavy watery discharge, B. Severe bloating, C. Profound weight gain, D. Cessation of menses. Answer: A. Watery or bloody discharge. 25. Risk factor for ovarian cancer: A. Multiple pregnancies, B. Long-term breastfeeding, C. Infertility, D. Early menopause. Answer: C. Infertility.
26. Protective factor for ovarian cancer: A. High-fat diet, B. Oral contraceptives, C. Smoking, D. Early menarche. Answer: B. Oral contraceptives reduce ovulation. 27. A cervical lesion confirmed as CIN3 indicates A. Mild dysplasia, B. Moderate dysplasia, C. Severe dysplasia, D. Invasive cancer. Answer: C. Severe dysplasia. 28. A major complication of untreated cervical cancer is A. Cardiac failure, B. Renal failure due to ureteral obstruction, C. Liver cirrhosis, D. Infertility only. Answer: B. Ureteral obstruction to renal failure. 29. Gold standard diagnostic test for endometrial cancer: A. CT scan, B. Transvaginal ultrasound, C. Endometrial biopsy, D. MRI. Answer: C. Endometrial biopsy. 30. Ovarian cancer often spreads by A. Direct extension and peritoneal seeding, B. Blood-borne only, C. Lymph nodes only, D. Respiratory droplets. Answer: A. Peritoneal spread. 31. Risk factor for cervical cancer: A. Late sexual debut, B. Multiple sexual partners, C. Cesarean delivery, D. Endometriosis. Answer: B. Multiple partners. 32. A woman with Lynch syndrome is at high risk for A. Ovarian and endometrial cancer, B. Cervical cancer, C. PID, D. Fibroids. Answer: A. Lynch syndrome increases risk. 33. Which patient complaint is concerning for endometrial cancer? A. Cramping during menses, B. Irregular spotting in menopause, C. Vaginal itching, D. Thick white discharge. Answer: B. Postmenopausal spotting. 34. A late sign of cervical cancer is A. Painful urination. B. Leg pain or swelling. C. Light spotting. D. Pelvic fullness. Answer B. Tumor compresses nerves or lymph. 35. Oral contraceptives reduce risk of A. Cervical cancer. B. Ovarian cancer. C. Vaginal cancer. D. Vulvar cancer. Answer B. Ovarian cancer.
36. A premenopausal woman with abnormal heavy bleeding may require which test first? A. Colonoscopy. B. Pregnancy test. C. MRI. D. Chest X-ray. Answer B. Always rule out pregnancy. 37. Which condition increases cervical cancer risk? A. Smoking. B. High BMI. C. Diabetes. D. Hypothyroidism. Answer A. Smoking is a cofactor for HPV. 38. Which finding suggests advanced ovarian cancer? A. New severe back pain. B. Hair loss. C. Persistent cough. D. Breast tenderness. Answer A. Often from metastasis or ascites. 39. Treatment for CIN2 typically involves A. Radiation. B. LEEP procedure. C. Hysterectomy. D. Oral contraceptives. Answer B. LEEP removes the abnormal tissue. 40. First-line treatment for ovarian cancer is A. Chemotherapy plus surgery. B. Radiation only. C. Hormone therapy. D. Antibiotics. Answer A. Debulking plus chemo. 41. Which finding after hysterectomy for endometrial cancer requires urgent report? A. Light spotting. B. Fever and foul discharge. C. Mild abdominal discomfort. D. Decreased appetite. Answer B. Infection sign. 42. Early symptom of cervical cancer is A. Dyspareunia. B. Abnodal vaginal bleeding. C. Severe abdominal ascites. D. Nausea. Answer B. Early bleeding sign. 43. A woman with chronic anovulation is at risk for A. Ovarian torsion. B. Unopposed estrogen to endometrial cancer. C. Bacterial vaginosis. D. Cervical stenosis. Answer B. Unopposed estrogen. 44. Which medication reduces endometrial cancer risk? A. Estrogen-only therapy. B. Progestin therapy. C. High-dose androgens. D. Antibiotics. Answer B. Progestin counteracts estrogen.
45. A high risk factor for ovarian cancer is A. Tubal ligation. B. Family history. C. Regular exercise. D. Oral contraceptives. Answer B. Family history. 46. Which procedure prevents ovarian cancer in high-risk women? A. Oophorectomy. B. D and C. C. Cone biopsy. D. Pap smear. Answer A. Removing ovaries. 47. Which symptom strongly suggests ovarian cancer? A. Dysuria. B. Persistent abdominal bloating. C. Headache. D. Nausea after meals. Answer B. Bloating is a key sign. 49. What is a common site for cervical cancer metastasis? A. Brain, B. Lungs, C. Kidneys, D. Bones. Answer B. Lungs. 49. Primary prevention of cervical cancer includes A. Pelvic exams, B. HPV vaccination, C. CT scans yearly, or D. CA-125 monitoring. Answer B. Vaccination. 50. The most common age group for endometrial cancer is A. 15 to 25 years, B. 25 to 35 years, C. 40 to 50 years, or D. 50 to 70 years. Answer D. Common postmenopausal age. Thanks for watching MCQs Master 101. If you found this helpful, don't forget to like, comment, and subscribe for more high-quality medical MCQs. See you in the next video. Keep mastering success.